Alright, we're getting started now with pathologies that you might find in the extremities and skull that are considered additive. And anything in these areas that are additive are going to be more dense or thick. So the additive diseases of extremity in the skull will be something that adds to the bone or adds to the thickness or density of the bone, or it could be an increase of fluid as well, so making it harder or more dense, right? So we have acromegaly, which is a disorder where there's too much growth hormone and the bones increase in size. Hydrocephalus is the buildup of fluid in the ventricles within the brain, so more fluid, more dense. These patients might have one of those VP shunts that drain the fluid out. The osteochondroma is the overgrowth of cartilage and bone that happens at the end of the bone near the growth plate. Paget's disease, I think, is our number one that we should know. It also is sometimes called osteitis deformans. So it's characterized by abnormal cycle, process of bone destruction. There's excessive bone growth and thickening. It has this cotton wool appearance, and I'll show you a picture in a minute here. Sclerosis is the stiffening of the anatomy, and then osteopetrosis with a T. Careful, because it looks like osteoporosis. Almost, but it has a little bit of difference in the spelling. So osteopetrosis is also called the marble bone. The bones are thicker and more hard and dense, but brittle at the same time. So here's just some images of those pathologies. The first three are demonstrating a VP shunt. A patient with hydrocephalus might have one of these shunts in place with the tubing starting in their skull. It'll come down their neck into the chest and then drain into the abdomen. And some have multiple or different lengths of these. Here's an example of your marble bone. See how bright white it is. So this is the petrosis. I kind of use the word petrified, white as a ghost, to help you remember that. The osteochondroma is oftentimes found here right in the knee area. It can be also in the upper bone, but I think picture-wise, this is the one I would look at. Paget's, or your osteitis deformans, that cotton wool appearance. See how fuzzy this skull looks? It looks, white and fuzzy like cotton wool. Or a pelvis. Oops, sorry, I flipped over. The pelvis picture, you can see how kind of fuzzy, white, patchy areas here. So this one is one I definitely would know definition and picture-wise.